Ciao mondo, hello world, hola mundo, hello mon. We're here today in the middle of the Indian Ocean taking a cappuccino with you and discussing a new series of papers coming out in blood purification regarding Ebola virus and the blood purification. In particular, there is a special focus on blood purification with 3 papers. The first from Faubel and co-workers discussing how to manage the patients who require renal replacement therapy and are infected by Ebola virus. They mostly discuss all the preventive measures to avoid cross-contamination with the healthcare operators and the possibility to avoid any type of complication related to the patient and to the treatment. The second paper is from Butner and co-workers discussing the management of the case of an Ebola virus infected patient coming from Africa and moved to Germany that was treated together with the pharmacological approach and the hemopurifier, which is a kind of selected adsorption of viral particles made by a plasma filter, which indeed reduce the circulating load of viral particles. And the third paper is an editorial from myself in which I discuss how the history of viral infection and dialysis goes back to the origin of dialysis. In particular, we started with hepatitis B problem and contamination until we started disinfecting the tools, disposing devices, disinfecting dialysis machine, and vaccinating the patient, and this made a significant reduction in the incidence and prevalence of hepatitis B patients. Then we had the non-A, non-B hepatitis leading to the discovery of hepatitis C, which was an epidemic until a certain point in which we started to control the infection, and indeed the prevalence and incidence was now controlled. Subsequently, we had the problem of HIV and acquired immunodeficiency syndrome, and today the treatment of patients infected with this virus is almost a routine, and we know exactly how to manage these patients. Today the new challenge is the Ebola virus infection, and therefore we have 3 special areas of interest to discuss. One, how to manage the patient infected by Ebola virus that requires renal replacement therapy. The second is, can renal replacement therapy influence the outcome of these patients by removing cytokines, by restoring the homeostasis of these patients, by treating uremia symptoms. And finally, the third is extracorporeal therapy can actually help to remove viral particles through the use of this hemopurifier, which is a lectin-specific adsorbent bed in which viral particles are bound to the sorber, and therefore there is a significant reduction in circulating viral load. All these aspects, together with other questions such as are viral particles cleared by dialysis membrane, should we adjust the retroviral dose of drugs in patients requiring renal replacement therapy, and many others, are discussed in these 3 papers in blood purification. And with this, I invite you to take a look to these papers, and I wish you a wonderful, wonderful day. Thank you very much.